Hi, this is Dr. Mike Maroon, and I'm your host for today. We have a SmileSource vendor presentation with HR for Health, and we're happy to be joined today by David Dee, Esquire. He is an attorney. He's also an account executive for HR for Health. David, how are you today?
I'm good, thanks, Dr. Maroon. Thanks. How are you?
Good. Thanks for being on, and looking forward to listening to what you're going to share with our SmileSource members. So, why don't you start off by telling us a little bit about who you are and how your company got involved with SmileSource?
Okay, thanks. Yep. As you said, I'm an attorney. I'm also an account executive with HR for Health. I've been involved in the healthcare world, primarily in dentistry, for 20 years plus now, and happy to be with HR for Health and helping doctors get compliant and stay compliant with the laws that are changing all the time, and that's kind of why HR for Health was born. I'll give you a little background on the company. We've been doing this since 2010, and the way it started, our founder is a dental attorney. He represents dentists all the time, and in 2009 he was planning for his 2010, and just looking back on the year, and he saw that on average he was defending dentists 1.2 times a week. I know it doesn't sound like a huge number, but every week he had a case where a doctor was being sued predominantly by a hygienist for wage and hour things, didn't pay me correctly, breaks, lunches, all kinds of different reasons like that. And so he saw a need and, didn't want to have to be defending people all the time for things like that. So a company was born, and, he really is passionate, as are we all, about keeping dentists. His wife is actually a dentist as well, but keeping dentists compliant with the laws, and they're changing all the time. And we're up on that. That's all we do, is make sure that we're always keeping you compliant with all the laws. And we're happy to be involved with SmileSource. Obviously, you guys really vetted us. You don't have people willy-nilly be your preferred partners and vendors here. So you put us through the ringer to go through what we do and how we do it and everything. So that's just a bit of background, and we're happy to be involved with SmileSource. And so I just want to tell you a little bit of what we do and why we do what we do. I'm going to divide this presentation up into two parts. The first is really just going to be a bit of a why, and then the second will be a little bit of a how, and I'll show you a bit of the software that we have and how we do what we do. And certainly feel free to jump in if you have questions. I like, typically when I'm talking to a doctor, it's very interactive, where I want to learn about you and the practice and your HR goals and what your headaches are and things like that, so I can make a recommendation based on an assessment. And here I'm more presenting a general overview, so if you have questions, please let me know.
Well, I think the first thing is that most dentists don't even think about HR. We are in our practices and we hire people, and HR, what's that? It's unless you have a really big office and you're dealing with double-digit employees, if you're a single practitioner and you have under 10 employees, you're really not thinking about HR until something does happen, like what you talked about, one of the experiences that you talked about. So I think this is good, just hearing the background and understanding what HR really is will help all of our dentists to understand why there's a need for this in their practice. So go ahead, take it away, and I'll try not to interrupt you too much, but I will.
Then, no, please do. And I'm glad you said that, because that's exactly right. I mean, that's the thing that we come across all the time, is that really HR is on the back burner, if at all. Like you said, it's really a case of you don't know what you don't know, and you think that, well, I'm kind of small, I'll deal with this later. And unfortunately, we get a lot of calls, horse and barn door kind of thing, where someone did something the wrong way and stepped in it, and they're in trouble now. And so we need to kind of guide them through that and prepare so that doesn't happen again. So that's a very good point. And really, my experience with the small to mid-sized practice is you don't have someone on there that knows about HR. That's certainly not a dedicated HR person with any kind of background. You have, typically if you have an office manager, it's someone who's stretched kind of thin, has so many things going on, and this really gets overlooked. Or if you, the doctor, if you're doing it yourself, same thing. You're typically not having an HR background, and you need to be generating revenue and doing things that are making you money. So this really goes by the wayside. So let's go through it a little bit here. This is what our mission is, and I'm not going to read the slides, but well, maybe I will read a few if there are people who may be just listening to this and not watching it. I don't know, but we do want to help you be fully compliant with all the laws and really have harmony on the team, and make sure that things are going along well and smoothly, and that HR is not a huge headache for you. And it's a combination of, we've got software and we've got a team of HR professionals and attorneys and a lot of support for you overall. So that's what we're doing. This here, if you're looking at this and seeing this, I referenced this a bit a moment ago, how busy your day is. And this really does tend to, fall off your radar, and you have so many other things going on. So it's something that, ignore it at your peril, really. If it falls off the radar, that the laws are changing all the time, if you're not compliant with it, and, you're just kind of going along hoping you're going to be lucky and not have any of these face you, that's just like driving without a seatbelt in a way. You're just kind of tempting fate a little bit. So we are really here to talk about outsourcing. We are here to talk about making sure that you are doing things that are revenue generating, and that the things that aren't making you money, you are not worrying about. And, and it certainly may sound a bit self-serving that, I'm talking about HR and I'm saying outsource your HR. I say this with, don't try to be doing your own payroll. Don't try to be doing your own marketing. Don't try to be doing your own website, things like that. Leave it to the people who that's all they do. So, so that's a big part of what we're talking about here as well. These issues on the screen here, we're hearing these a lot. I will ask a doctor, read this list, tell me if any of them resonate with you. And I hear laughs, I hear groans, I hear sighs, the floodgates will open, and I hear stories about how, oh yes, this is, I have these happening all the time. And
so David, David, I just want to interrupt for a second. So for those who are listening only, the issues that he's talking about are the following. I feel that handling employee issues myself is not the best use of my time. Most of my personnel issues center around one or two team members. Employee issues are keeping me up at night. That one is an interesting one. I always tell my wife that if I ever have to come home and talk about an employee, it's time for that employee to leave. I avoid employee reviews because they take too much time. I have trouble holding team members accountable. I'm having trouble retaining my best employees, and I have felt held hostage by an employee I was afraid to terminate. I think that most business owners at one point or another have felt all of these.
Yes, and thank you for reading them and reminding me that some people are just going to be listening and not looking. And yeah, and that bottom one, the held hostage by someone you're afraid to terminate, I hear that one a lot. Like, oh, I have someone who's the bad apple and I want to let this person go, but there's a vindictive streak there, and I'm worried about what's going to happen, and are they going to take other team members, and are they going to sue me? And so yeah, these are very prevalent, and so we want to help you not have to deal with these. And a little side note, a lot of times I find that a lot of doctors are non-confrontational, and I get the question a lot, do you fire people? Okay, will you fire the people for me? And no, we don't go that far, but we will, we'll guide you through everything, and really, ultimately we want to really start at the beginning and make sure that you're not worried about that, because you know you have your ducks in a row. And if it comes time, like you said, if you're talking about someone at home, it's time that you feel like you're bulletproof and you've got all the documentation and everything you need. So we'll talk about that a little bit here. And so now on the screen, there's a little pyramid. The slide's called Maximizing Employee Success. And, from the bottom up, we've got the bottom section talks about the employee handbook and job descriptions. And that's really the foundation of it. You want to set expectations for the team of what you expect, twofold, really, what your policies and procedures may be as the business owner and what the law is as well, and really set the expectations of communication with you as well, so they know how to talk to you, what their recourse is for things, and really try to nip things in the bud instead of letting them fester. The next level up is talking about timekeeping and benefit tracking. You want to make sure that breaks and lunches and overtime, and that you're compliant with all of that stuff. And talking about, I mentioned the lawsuits at the beginning, and it's 6 years in a row now where employee lawsuits have far outpaced malpractice. So really, we're talking about this as protection of your interests and risk mitigation and threat reduction, the threat is really internal more so than from patients. So that is where doctors are being sued the most. It's wage and hour stuff. You didn't pay overtime, I didn't get breaks, etc. So that's a huge part of that. I will talk about it a little more, but timekeeping is very, very important, and you want to really make sure that you have everything documented. And then the next step up is performance management. You want to monitor things and measure them and get the most out of the team and improve them. There's a saying that what gets measured moves. If you're on a diet, you're going to be stepping on that scale every morning. You want to look at things and see where your progress is. You want to do the same thing with the team, because successful employees really drive results for the practice. So we want to look at this as protection for you and really getting the most out of your team. So this is our our 9 pillars, if you will, of what HR for Health does. And I'll just read them quickly for, again, those who aren't looking right now. At the center is really the handbook. Like I said, that's the foundation of everything. You want to have that. If you don't have a handbook, you really need a handbook. And then we have integrated payroll as well, and I'll touch on that a little bit later. We have a cloud-based document vault. So everything that we do, our goal is to really be your HR department. We're going to be your offsite HR department, and everything that you're going to be doing, or you are doing, or should be doing with your team management now, either in paper format, either 4 or 5 different spreadsheets, however you're doing it, we want to consolidate it and make it paperless and cloud-based. So everything is in a vault. It's all online with security. Everybody's going to have a username and a password, and they're going to have access to only what they are allowed to have access to. And then benefits tracking, employee documentation, task management, access to our team of HR specialists and attorneys to help you in situations that may get a little sticky, time and attendance tracking. And then the last one here says data-driven tools for performance management. So ideally, you should be doing performance reviews. I hear a lot that I want to do them, I don't have time to do them, or I hate to do them. Going back to the confrontational thing, if there's an issue that needs to be addressed, it's easy to avoid what we don't want to do. And then one objection that I hear a lot is every time I do a review, they think that means it's time for a raise, and my team's kind of topped out now, they're paid really well, I don't want to have to give them a raise every time, so I just don't do the reviews. But going back to setting the expectations and open communication, you really want to do those reviews, whether it's your rock star who gets that pat on the back, or whether it's someone who needs a little improvement to go from, a B player to an A player, you want to do that. And part of what we give you with everything in one spot and all these systems talking to each other is metrics, so that you can do a quick, easy, objective review, and it's not such a horrible time for you.
Hey,
So,
David, can I interrupt for a second, interject and ask a question?
sure.
One of the questions that I'll always hear from people, especially online, is if you're doing a review, should you do it one-on-one with the person, or is it always better to have someone else in the room with you to kind of hear what's going on and make sure that, that there's some kind of witness there? Can you just talk about that briefly?
Yeah, I think it's a good policy to have someone there as a witness, so that, typically what we have is a doctor and a manager will have a meeting with the person, so that there's someone there. And part of what we do, and I'll talk about this in a bit, is have the person do a self-assessment as well, and then you can talk about it. But yeah, part of one of the main reasons of having all this documented is, again, I'm going to hit that note a lot, of your protection and protecting your interests. And, if things devolve into he said, she said kind of thing, and you don't have all your ducks in a row, you're going to be on the losing end of that typically, because all the laws, they're all weighted in favor of the employee, and you want to have all this to prove your point. And certainly having a witness in there, prevents anybody from bringing any baseless claims against you, or, oh, we were behind closed doors and you said this. And so, yeah, so that's a good practice. I'm glad you brought that up. Thank you. And you have to be careful. So many of the things that, I could spend our whole time this morning just telling you horror stories, but you don't have to, the employee doesn't have to be telling the truth to win. You let somebody go and they become that disgruntled employee, and they're out to get you, and they're going to make these claims. And if you don't have things in place, you can be in trouble, and that trouble comes with a large price tag typically. So yeah, good point. Thank you for that. So I'm just going to quickly go through these at a high level, and then I'm going to show you and talk about a little bit of the software. So even for those of you who are listening and not looking, you can still get a flavor for this, and and I'm happy to connect with people one-on-one as well, to talk specifics about your practice and show you if a better time would make it easier for you. But so moving on, the handbook, you want to have your handbook be professionally done. You want it to be dental specific. You want it to be state and sometimes county specific, tailored to your practice size and your goals and your culture. I hear a lot of doctors who they've worked on their own, or they've had the manager do it, or find some template, or, my cousin's a dentist and he gave me his kind of thing. That's certainly better than nothing, but it typically doesn't cut it, because you want to really have everything specific to what you need. And the laws they're always changing, and they're different state to state. So, unless the cousin who's a dentist scenario, unless it's, in the same location, same size, etc., it's not a one size fits all thing. So our handbooks are customized. We're going to go through and really make sure that what you have suits you and is legal. We've had a lot of issues where someone, the doctor will say, yep, I did it myself, and I just put in my policies, and there's a little bit of that my way or the highway kind of thing. This is my practice, my rules, and more often than not, we're finding something in there that's not legal. And it seems, it's not any real draconian kind of thing. It may seem innocuous enough, but it's not legal. So we really want to make sure that everything is on the up and up, as it were. And this is what we do. It's not, it's not the handbook that you're going to get from your payroll company that is the same handbook that the dry cleaner has, and the massage parlor has, and the pizza place has, whatever. You get the idea. Have it be customized. So that's a big part of it. And if you need to update it, and at the bottom part of the slide says annual updates included, we're always going to be proactive to make sure that's always current. If the laws change, we're going to let you know. So that's a little bit about the handbook. Documentation, you really want to have everything in the file that you need to have. On average, there are 12 documents, and I get to remember to read these slides more too. On average, there are 12 documents that you need to have for each employee. Again, different from state to state, that's an average, but if you get audited, you want to make sure that you have everything. And I just read an article this week, given the current political climate and things like that, and they're really doing much more of auditing of that, especially of I-9s, to make sure people are legal. So that's happening way more. So, and we can talk about that on an individual basis as well, but you want to make sure that you have all the right documents. And again, we're going to make sure that they're always the most current version, they're all cloud-based, and they're all read and signed online. So again, making all of this paperless. And again, I said it is cloud-based, so nothing goes on your machines, nothing goes on your servers or anything like that. I mentioned before the role-based security with the username and the password, and everything is backed up and secure and protected. So now the slide that I have here is the strategic time and attendance tracking, and it says transform your time clock into a strategic management tool. And that's really what you want it to be. Going back to what I said about how wage and hour is the most prevalent lawsuit against the doctors, typically the punch clock by the door, or even your practice management software isn't as robust as you need it to be. Again, certainly better than nothing. I've talked to the doctor who says, we're a team, everybody loves me, we come in, we work till we're done, and we go home. Okay, that's great that everybody loves you and it's a family atmosphere. I certainly support that, but my response to that is always, they love you right up until they don't. And if you're not set at that point, you're in trouble. So, the software is the software. For practice management, that's what it's designed for. It's designed for the patient management. The clocking in for the team is really an afterthought. So, it's the same whether you're in California or Connecticut or New Jersey. It doesn't differentiate. With us, analogous to the handbook, the time clock is really going to know that, okay, this is David and he's clocking in, and it's a dental office and it's in Connecticut and it's got 10 people and this is how he accrues his benefits. And so everything that is involved in your team's employment with you is tied to that username and password. So it's all tracked in there. It's going to track the breaks, the lunches. You can run reports on who's tardy. It'll let you know automatically who's tardy. It's got tracking of PTO and sick time, and it just in addition to your compliance, it's going to make running the payroll a snap. What I typically will ask a manager, if I'm talking to a manager about this, or even if it is the doctor who's doing it, whoever's doing it, when I say, tell me what your biggest HR headache is, the thing that tops the list the most of the time is running payroll. And especially the bigger the practice, the longer it takes. They've got to calculate this and that. They've got to run the report, look at overtime, on down the line. With us, it will take a minute, pretty much literally, to run the payroll report, because everything's in there. You just pick the start date, the end date, the employee, and it's all there. There's no math that needs to be done. There's no any kind of manual calculation. It's automatically tracking overtime. It's automatically already in decimal format. Another thing I hear a lot is they forget to clock in, they forget to clock out. So I've got to go back in, or I do the payroll and I have to go back and recreate. And this really puts the responsibility for that on the employee where it should be. So they will go in, just kind of by way of example, they'll go in and say, on Friday, I clocked in 27 minutes late because we had an emergency and it was crazy. And by the time I clocked in, it was 27 minutes late. And that will go to you. Let's say you're the admin for conversation's sake here. It'll go to you and you'll say, oh yeah, I remember that day. You click accept and it's done. So there's no going back in and changing and whatever. It's automatic and everything's time stamped and date stamped. So, that's very important. So I'm taking a little more time on the time aspect of it because that's, with the handbook as the foundation of everything, wage and hour stuff, that's really the key to labor law compliance. So that's a very important part of it. Okay, moving on to the benefits tracking. It's good for the team as well. I know I'm really hitting the note of protection for you and protection of your interests, which, that's huge. But for the team to have a place to go to look at, okay, how much PTO do I have? Or let me look at the handbook. What's our policy on X, Y, and Z? And they, if they want to ask for time off, they can do that from home instead of having to go in and fill out a piece of paper in the office, things like that. So having that access to everything anywhere they have internet access is very important, which reminds me to back myself up for a second here. Another feature of our time clock is it's IP specific. So it's tied to the IP address in the practice. So nobody's going to be clocking in from, the drive-through at the coffee shop or the parking lot or whatever because they're running late. They've got to be in the practice. And it's also tied to the world clock on the internet. So no funny business of someone saying, oh no, I'm late. I'm going to change the computer clock in, change it back. It's going to give you absolute precision. So it's good for you and good for the team as well. And going back to the complaints that I hear, the tap on the shoulder kind of thing of, hey, can I have Friday off? Or tell me how much vacation time I have left, or the sticky note on the computer, this does away with all that. So it's going to make, it's not designed to replace anyone doing this, but it's going to make whoever is typically handling this stuff much more efficient. So task management as well, we're talking about, the slide here says communicate expectations and monitor progress to ensure accountability. So you will assign tasks through the portal. And then when they're done or not done, there's a record of, yes, I did it, no, I didn't do it. So, asking someone to do something is the easy part. Getting that accountability and completion rates and things like that, that's the part that can be tough. So having this automatically in there, it's a real easy way to, again, get those metrics when it comes to review time. So you'll have that, instead of going into a review saying, off the top of your head, okay, what did David do for the past year? And wasn't he late? And gee, I asked him to do these reports at the end of the month. How many did he do? To be able to go into a review armed with, hey, that monthly report, you only did it 6 times, or you were late 32% of the time, have those stats at your fingertips. Again, getting the most out of the team, having an objective review. And I'm getting ahead of myself here because now the slide talks about data-driven tools for performance management. So again, going back to what I said at the beginning, the successful team drives the results of the practice, and having this performance review be customizable and have all the information in there, and it's collecting that data in real time throughout the year. You're not having to sit back and try to recreate the year in your head. And also on this slide, it says kudos praise system for recognizing success. I know we're really talking about protecting you against the big bad employee, but this allows you and the team to give kudos to team members for great performance. So it's a good way to boost morale that way and recognize success. We're going to be talking about, write-ups and things like that. So we don't want to focus on the negative. So it's got some positive built in. Fully integrated payroll is what we're looking at now. And it says integrated payroll and time clock with one-click submission. So again, going back to the speed and accuracy of it, with 3 clicks, you have run and submitted your payroll report. So no more, I have to download my report from Dentrix or whatever software you're using and do all that math and do whatever. It's all in there. It's unlimited payrolls, whether you pay weekly or bi-weekly. If you have to pay someone you're terminating with the last paycheck, all of that. It's got all the tax filings and payments built in, all the deductions for 401k and health insurance. It's going to automatically report the new hires to the government, and it's got all kinds of things in it. The bottom point on the slide here says automatic calculations for non-discretionary bonuses and weighted averages. So it's, in addition to automatically calculating the overtime, it's also, it can be a way to save you money by, if you have someone with different rates of pay, you have someone in the hygiene department, let's say, who gets $50 an hour to pull a number out of the air, and they also do some admin and they get $25 an hour for that, and they work overtime, you're not automatically going to pay it at the higher rate. It's going to blend that so that the overtime is paid on really what the average hourly wage of the pay is. And so it's all going to be saving you money and making sure that your payroll isn't inflated. And in the handbook, we're going to address what your policies on overtime are. Does it need to be approved, etc. So the handbook's really going to cover all this from the beginning. And then access to HR specialists and attorneys. This is, again, what we do. We get calls every day from our doctors to guide them through situations, whether it's a simple question about the law or whether it's, hey, it's time for this person to go, or this person did this, or what do I need to do? Call us, call us, call us. I beg all of my new doctors, please don't guess at anything. Call us, let us guide you through it. That's why you have us. Let us keep you out of hot water. So that's a big part of it. So, to kind of wrap up this part of it before I show those of you who are looking a little bit of the software, the slide says shaping your future. This is what it's about, is getting you to a compliant, risk-free, thriving practice. And just the bullet points on this slide are a working handbook that sets expectation and motivates the team, timekeeping for wage and hour compliance, annual reviews that are done on time with positive results, and then your time or your manager's time freed up from these HR duties to focus on the practice growth. So that is really a big part of it. And so, Dr. Maroon, before I kind of poured over to a little bit of what the software looks like, or maybe I'll just show these the screenshots that I have here. Any questions on that? I know I'm compressing a lot.
I think you gave a good overview of all the things that your company's doing and why it's important to consider HR for health. I also think now that it's important to show like what your software can do. So don't necessarily worry about the people who are listening to this, just the people who are watching it. Show them, how the software, how you navigate through it, and where all these things are that you just mentioned.
Okay. Thank you. So here's just an example, and I'll show you the live site in a moment, but I just have a few screenshots of things. This is the Office tab, which shows you all of the different things that are built in. And my disclaimer typically when I'm going through this is don't be put off by the scope of it, because it really is everything that you need for your team management in one place. And some people who have no HR to speak of, or if it's a brand new practice, whatever it might be, this can be a little daunting, especially when I get the call from someone who says, I really just need a handbook. And then, okay, well, we're talking about a handbook and this whole system. We hold your hand through this as much as necessary. We train you, we train your manager, we train the team on how to use all this. So it's not as daunting as it might seem, and it's really making sure that your I's are dotted and your T's are crossed. And I tell all my doctors that we will roll this out at a pace that's comfortable for you. So it's not going to be a shock to the system. We really want to start with, let's get all the documents read and signed. Let's get your handbook going. Then if you want to use our time clock, let's look at a date on the calendar when you want to switch over. And then, okay, do you want to start working in reviews? And so don't look at this and say, holy moly, because it's, we're gonna meet it out at your pace. So So there's the Office tab that has all the things in there. You can see, those of you watching the top right, the templates, all of that stuff is templated, you know, because this is what we do. We've got every job description in dentistry. We've got the development plans, the new hire checklist, it's state specific, all of that stuff. And it's all customizable for you. So it's, again, not one size fits all. We're going to make sure that, you know, if you have someone who wears multiple hats, we're going to make that job description reflect that. So here's just an example of the e-signatures, the 9-9, and it's just everything is just read and signed online. So it's a fast, easy way to make sure it's always current. Here's a screenshot of a sample new hire checklist. So when you hire someone, they're going to, you know, get an email from HR for Health to go in and create their username and password. They're going to have this checklist waiting for them to read and sign everything. And, you know, you can run a report on what hasn't been signed yet, and, you know, breaks it down by employee, breaks it down by document. So it's all in there. It's all user friendly. Here's just a close up of what that looks like, and all the things that you see, all the tops of those columns, you know, what's the action process, what's the obligation, all of that. It's the kind of thing where if you hover over it, you can get an explanation. So again, very, very intuitive and easy to use and user friendly. And you see all the tabs across the top, the job description, the timesheets, the checklist, the performance reviews, violations. It's all built in there. So here's an example. I'm just going to go through a few of these quickly, and then I'll show you what it actually looks like live. So, you know, again, the job description is all there. We're going to have everything that you want in there. Here's an example of just what leave of absence request will look like. And again, all done, you know, they can pick what type of absence it's going to be, start date, end date. Do they want it paid, not paid? So again, just all tracked, none of that paper system in a basket on someone's desk where, hey, you put yours under mine, I was in first. No, you didn't. You know, all the kind of drama that comes with that kind of thing that I hear about constantly. This is going to put an end to that. And violations the same way. You want to track, you know, whether it's a tardy issue, whether someone, you know, didn't speak kindly to a patient, to another team member, whatever it is, document it. You want everything documented so that it's in there. When you have a review, you can talk about it. If you go to terminate someone, you have all of that there. You know, I caution all of my doctors, when you let someone go, it should never be a surprise. You know, you want them to know that, yeah, we talked about this. You know, they may be mad at you when they go home, and they'll stew, they'll think about it. And, you know, you want the kind of thought to be, yep, kind of saw that coming. You know, no one to blame but myself, because I got warnings, I got written up. We talked about it in my review. We had a development plan. So, you know, you have everything for your protection. So that's all built in. It's got progressive discipline built in. You know, it's not an automatic thing of, okay, you did this and you're fired, or, you know, and you want to be consistent. A key to all of this too is being consistent. And that even starts with the hiring process. You know, we guide you through that as well. I tell all of my doctors who are in a hiring phase, let us look at what you're going to post to get resumes. Let us look at the interview questions you're going to ask. Make sure you're not asking the wrong thing, because that can be a dangerous part too. You know, people seem to be much more focused on the termination phase and, oh boy, I'm going to fire someone, I'm going to get sued. And that's a very real danger. But at the other end of the spectrum, it is too. You know, you ask the wrong questions, you find out the wrong information about someone, ultimately don't hire that person, then all of a sudden you're on the wrong end of a discrimination lawsuit. You know, you didn't hire me because fill in the blank. So be careful in that as well. And tardy tracking, you know, the punch clock by the door and things like that, or whatever you may be using, you know, you have to go look. If you have to look, okay, every day, David's supposed to come in at 8. Let me look at the past 2 weeks and see. This is going to give you, you know, a click. You have that information. It's going to email you when people are tardy. You're going to be able to see everything that you need to see. It's also going to track your CE units. It's going to track certifications and licenses. It's going to prompt you for when things are due. So, in addition to having everything here at your fingertips, this is going to push information to you as well in the form of, okay, tardy alerts. These are the birthdays coming up this month. These are the work anniversaries coming up this month. Make sure this license is up to date. If you have someone who wasn't on top of that and they're doing prophies and their license is expired, that state can come in and shut down the whole practice. So we want to make sure that everybody is on top of everything.
So David, as part of the package that you guys have, and I know we're about 15 minutes from our end of this webinar, but what I wanted to ask was, as part of the package, what you're showing here, is that everything that comes with the initial package? Is there anything that that doesn't come with what we're seeing here that are add-ons, or is it all a la carte or all inclusive?
It's all inclusive, and thank you for asking that. And yes, I'm looking at the clock too, so I'll be getting ready to wrap up. And thank you all for staying with me this long here, because I know I'm really just shooting it out at you from a fire hose here.
You're a lawyer, so you're used to talking. So I mean,
yeah, I just need to work it out so that I get paid by the word. I'd be a millionaire. But yes, and thank you for asking that. It is all inclusive, so that it's not a la carte. It's not. I know there are some companies out there who, okay, at this level you can talk to us for an hour a month, and at this level you can talk to us for two. If you're in a sticky termination situation, you don't want to be looking at the clock. You want to be able to call and get that advice and all that. So no hidden costs for that. If you need to, like I said, change your handbook 5 times a year because you want to change your policy or whatever, that's all part of it. And we have 2 tiers of, I'll sort of jump to this since we're talking about it now, and then wrap up with some other stuff. But we have 2 products. One is called Compliance Navigator, and it's everything we're talking about. It doesn't have the integrated payroll. If you want the integrated payroll, that's called Compliance Complete, and it's everything. It includes a payroll, it includes your compliance posters, it's everything. So it's, if I've had the doctor say, my spouse is a CPA, I don't need payroll or whatever. Okay, fine. But if you want it all in one, all complete, really that 3-click processing of payroll, the complete is the way to go with everything. But in either case, there's nothing a la carte, there's nothing hidden. You're not going to get charged if you call us too much or anything like that. So, so the review, so everything's there. I'm just going to go through this a little bit and show you. Let me show you quickly what this looks like here. I'm going to go over to the software. So did that switch for you, Dr. Maroon? Can you see San Francisco Dental?
It did.
Okay. All right. So here's what the portal is live. And let me just show you I talked about the metrics and talked about the reviews. So you can drill down to each team member and get objective information like this. And again, you want to be objective, you want to be consistent. This will show you at a glance all the positives and negatives. You can get scores for each team member. So how easy is it to just look at all your team and look at those numbers and see who are my A, B, C players? And then if you want to drill down and see what it means, it breaks down the positives and the negatives. It'll tell you their tardiness percentage. Have they had violations? Have you had to write them up? Are they absent? And for me, the tardiness percentage is way more important than knowing if someone's absent or not, because that's really, an insight into how they view the job and the practice. And, if they're late, typically they're going to miss a morning huddle. And if they miss a morning huddle, they're going to miss some key information, maybe about some patients who are going to come in, and things are late. And, I'm sure you all know what it's like to start something off late and spend the rest of the day catching up. So knowing someone's tardiness percentage, I think, is huge. You've got the year-over-year performance that's there. So it's all right there, and it tracks kudos too. You can see, hey, is this the person that everybody says does a great job? It's a peer review of sorts. So having that there is big. And then the violations. If Lisa here, our example on the screen, you need to write her up for something. Like I said, you just go here, you add the violation, you pick the type, lets you put in the details, lets you put in, is there a corrective plan? So everything's there. And I won't be aware of the time here. I won't go too much more into this, but it does give you all of that information, and it gives you, there's a section here called quick reports. So it lets you, it's just that, it gives you all reports on this information. Some of them are incomplete documents, absence request reports, if you want to see who's asked for time off, this is also going to be, again, pushing information to you. An example is, okay, there's a holiday coming up, this is who qualifies to get it paid, this is who doesn't qualify to get it paid, if people are still in their introductory period or whatever. So it's really soup to nuts, everything involved. And then I'll show you this, and then I'll give you some pricing information here. But the alerts requiring your action section here on the dashboard of your portal, it's again designed to make sure stuff's not slipping through the cracks. So anything, if you want to, it's going to cater to anybody's personality. If you want to look at everything in real time and get it done, it's all right there. If you want to do it end of the day, end of the week, end of the payroll period, it's all going to be there. So it's not going to be, oh, this piece of paper fell behind my desk or got under something or fell into the garbage, whatever. You get the idea. So, and you can look at a glance, the whole team, know who's clocked in, who's clocked out. This example here with this, Lisa clocked in for more than 5.5 hours in a different color. It's an indication that, okay, she hasn't clocked out for lunch. If she's in for this long, she hasn't clocked out for lunch when she should have. And so again, you want to see everything. And, when they clock in, it's just as easy as, there's a shortcut on the desktop. You clock in, it'll remind you about rest breaks. It'll tell you that you're clocked in. And you can see that it changed there in real time. Okay, it shows that I'm clocked in. So that's everything, I think, unless Dr. Maroon, have I missed anything? Do you have a question about this before I talk any numbers here, or what do you think?
I think you gave us a very good and thorough description of what's going on. Obviously, if people have more questions specific to their practice, obviously, since each practice is unique, they can, meet with you or one of the sales reps and get it taken care of and get a demonstration as to what is, what their solution could be for any particular challenges that they're facing. So, yeah, no, I think you did a good job. Let's wrap it up. Tell us the pricing, and thank you very much.
Okay, well, you're welcome. Thanks. And the last information point that I will make in talking about, being on top of things and the laws that are changing all the time, the big one now that's sweeping the country is mandatory sick leave. So be aware of that. Right now in 10 states and DC, there are sick leave laws. And in some cases they have them in certain counties, but not statewide. So be aware where you are. There's a couple that are coming up. I know Rhode Island's goes into effect on Sunday. New Jersey's goes into effect in October. So be aware of that. We can talk about that. And it's a necessary business expense. I really liken this to your malpractice insurance. You wouldn't dream of not having that, but the threat is more from inside than outside. And this is really kind of, insurance with a lowercase I. And so just quickly, the numbers here. So I mentioned our two different levels. So for the compliance navigator, we do it on a monthly subscription model. So it's not, hey, I need a handbook. Okay, it's going to be $5,000 kind of thing. We spread it out for you. So for that, it's $225 a month, and there's a setup fee of $795. So it's a one-time setup fee, and then monthly, and again, all inclusive. For Compliance Complete, which includes the payroll and includes the posters, and so factor in that you can get rid of whoever you're using for payroll, you can get rid of whoever's doing your compliance posters now. The basic price for that, the setup fee for that is $12.95, and typically it's going to be about $395 per month. That's the monthly price for Complete is dependent on number of people on your payroll. So for the $395, that covers between 4 and 15 people on payroll. If it's below 4, the price is going to be lower. If it is above 15, it's going to go up typically in about $100 increments per 10 employees. But usually the sweet spot of that 4 and 15 people on payroll, it's $395 a month. So eminently affordable for everything you're getting. Even better when you consider your SmileSource discount. So for the discount with SmileSource, whichever package you choose, it takes $400 off of the setup fee and $35 off the monthly fee. So you guys get a fantastic discount. You know, the sticker price, if you will, is worth it all day, every day. But you guys, you know, we value that SmileSource relationship, and you guys worked out a great deal with us. So, so that's it. I'll tell you, you know, like you said, if you want to follow up, I'm happy to do it on an individual basis. I'll give you right now my phone number and my email address. You can contact me, and we can go through your specifics more. Again, my name is David. My last name is Dee, D-E-E. My email address is first initial last name, so DDee at HR for Health, and it's the 4 is spelled out, HRFOR health.com. And my phone number is 925-334-5790. I probably should have had that on a slide to put it up there, but 925-334-5790 and DDee at HRforHealth.com.
So David, I'm on our, if you look, I took over a presentation. So on our SmileSource vendor directory page, this is the information that they have here. So the pricing that you gave us includes that 30% savings at the bottom, the end of the, when you went and said $400 off the setup fee and approximately $30 off the monthly fee.
Yeah, $35 a month off. Yeah.
Okay.
Yeah, and I think the contact information at the top of that page, some of that is outdated. So, yeah, you can, like I said, my information, the 925-334-5790, and then the DDee at HRforHealth.com. But that reminds me that I'm going to put a note to myself to make sure contact information is updated on the SmileSource page.
Okay. Great.
Yeah, well, I really appreciate you having me. It's, you know, I'm happy to get this information out because, like you said, it's, you know, people don't typically know what's what, and you don't know what you don't know. So thank you all for your time and attention, and I'm always happy to have a conversation with anyone. You know, if ultimately you decide we're not right for you for whatever reason, at least, you know, you've gotten some information and some guidance and some direction on what to do. So I'm happy to talk to all of you.
All right. Thank you, David, for your time. I appreciate it. And thanks for the presentation. And anyone who's interested in learning more about HR for Health can contact David personally. And I know you're going to get great service. Thanks again for being on, and have a great day.
Thank you very much, you all as well. And I hope to talk to you soon.